Good afternoon, everyone, and thank you all so much for coming to today's talking point, which is on a different day than our usual. This is a very special talking point because we've had an opportunity to have a presentation from Professor Stuart Kinner from Griffith University. So before I get underway and introduce Stuart, I'd just like to deal with a couple of quick housekeeping things, all of the usual. If you've got your mobile phones, please put them on silent. Very happy to shame people whose phones ring during the presentation. And just another thing, we are recording today's talking point, so it will be available online, and it is actually streamed online as well. But we have an opportunity for question time at the end, and that isn't recorded. So please feel free to ask Stuart as many difficult and confronting questions as you can possibly think of. You won't be recorded. So it is my absolute pleasure to welcome Stuart Kinner here today. Stuart is now at Griffith University, formerly of University of Melbourne. And Stuart and I have actually known each other for a very, very, very long time. We've worked together in Queensland in the early 2000s, even shared an office. And I worked for Stuart on a number of projects. So it's really lovely to have him here today. And Stuart's been doing some absolutely amazing work around health and other outcomes for prisoners post-release from prison. And has been working, amongst other things, on a large NHMRC-funded randomised controlled trial, following up 2,500 or so prisoners pre- and post-release in Queensland, incorporating data collection from those prisoners, and also linking a whole range of different data sets together to be able to better understand health and other outcomes following release from prison, which we know is a really high-risk time, both in the month after release, but also in the longer term as well. And from that, we can develop better evidence-based responses to support people as they enter back into the community and support the health of prisoners and also of the community more broadly. I hope I haven't said anything wrong there. Excellent. And so today, Stuart will be talking about a national surveillance system, a national surveillance and national monitoring system, monitoring mortality following prison release. So while we understand quite a bit about deaths that occur in custody, there's much less information available about mortality following prison release and what we can do to reduce the risks of mortality following prison release. So without me rambling on any further, I'm going to hand over to Stuart. Please make him very welcome.
Thank you. All right. Okay. Thank you everybody for coming on school holidays. It's great to have some people turning up, and thanks Belinda for inviting me as well. Just to begin, I'd like to acknowledge the traditional owners of the land we're meeting on, the Wurundjeri people, and to pay respects to their elders past and present. What I want to do is share with you some background and then talk about this surveillance system. Now, just to clarify, we've developed it and we've validated it. Nobody's funded it yet, and what we're hoping to do is make the case for it becoming something that's part of the landscape, something that is funded. So hopefully, I may well be preaching to the converted here, but I'm very keen to get feedback from people who already think this is a great idea, or people who hopefully will be a bit more persuaded by the end of it. I'm also very happy to stop and respond to questions or comments during this. I'm very happy to make it as interactive as you'd like. And also just want to acknowledge Simon Forsyth. The paper that talks about this development and validation is under review at the moment, and it's co-authored by Simon Forsyth from University of Queensland. So it's that particular part of what I'm going to talk about is a collaborative effort between the two of us. So, for those of you how many people here are familiar with the correctional system in Australia, either in a professional or a clinical? Some people are. Okay, great. Some are not. We're doing a cracker job of increasing our incarceration rate in Australia. It's going up at a rate well in excess of population growth, as you can see from this slide. Both the daily rate and the number. Now, I've said at the top there the expansion and churn, and that's critically important because while we can put up numbers here about the number of people in prison on any one day, what we really want to know, I'm arguing to you, is the number of people who move through that system, because we're not talking about some other species of people called offenders or prisoners. We're talking about members of our community who move through that system before they return to our community, and we want to know how many of those people there are. One of the things that we do know, and this is really a national shame about our correctional system, is that Indigenous Australians are overrepresented by a historical high of 13-1 age adjusted. And as you can see there, that gap in incarceration has widened since the Royal Commission, despite, of course, the Royal Commission into Aboriginal Deaths in Custody recommending that we do all we can to reduce the overrepresentation of Indigenous people in custody. I mentioned the lack of information on churn, and I just put this slide up to illustrate it. This may look to you, this is estimates of the number of people moving through prison each year on the y-axis and years on the x-axis. It might look like a random scattering of dots and lines, and indeed it is, but it also represents all of the published estimates of the number of people who move through prisons in Australia over various years. And I put it up there to illustrate that we really don't have a damn clue. The lines down here are ones that we published a couple of years ago, or last year actually, based on some extrapolating from some New South Wales data to try to estimate how many people move through prison each year. At the end of 2015, the AIHW published a compilation of data from all of the jurisdictions telling them how many people they think move through their prisons each year, and it was around 51,000. So we actually don't know how many people are moving through our system. And that's important when we start to think about the outcomes that we see after release from prison. So I mentioned the Royal Commission into Aboriginal Deaths in Custody. You may well be aware of this. It looked at all deaths in custody from 1980 until partway through 1989. So the key finding, I suppose, that for the purposes of this presentation is that Indigenous Australians aren't dying at a higher rate in custody, but they're so dramatically overrepresented in custody that there's a disproportionate number of deaths in custody among Indigenous people. So therefore, what we need to do as well, of course, as trying to reduce deaths in custody, is to reduce the number of Indigenous people going into custody in the first place, which as you can see, we've totally failed to do. One of the things that emerged from this commission is routine annual monitoring of deaths in custody. And Australia is certainly not the only country to do this. The UK does it, the US does it, for example. And although, of course, it's hard always to infer causal relationships here, you can see that since the Royal Commission, the number of deaths in custody each year, this is the rate, has actually gone down quite considerably. We're down to now about 1.5 per 1,000 people in custody on any given day. So the rate's quite low. Obviously, the number should be ideally 0, but it is going down. And the other thing that a lot of people don't realise is that while we do continue to have deaths in custody, the vast majority of those deaths are from natural causes. They're people who are serving long sentences, typically older prisoners who die in custody of natural causes. So as you can see here, this is the number of Indigenous and non-Indigenous people dying from natural causes, hanging, trauma and other. So most of the deaths that we do see in custody are from natural causes. We published a paper a few years ago now, just for comparison purposes, comparing the number of deaths, the total number of deaths in custody and prison in Australia in 2007, with two different estimates of the number of deaths within 28 days of release and within a year of release from prison. And these are estimates, but as you can see, if they're in the right ballpark, and we're confident that they were, the number of deaths within even a month of release from prison is considerably higher than the number of deaths in custody. And so one of the things we said here is we're not suggesting that deaths in custody aren't important. What we're suggesting is that deaths soon after custody are also important, and we really need to draw attention to those deaths as well. So this is a study we did in Queensland. It's unfortunately a very predictable finding. It's been replicated in other jurisdictions in Australia as well as in a number of other countries around the world. And what it's looking at, we did a study where we linked all releases from prison in Queensland over a 14-year period with the National Death Index to have a look at how many people died from what causes and when. And what this is looking at is the number of deaths in that cohort by week after release from prison up to the first year after release. So you can see there, you don't need to be a statistician to notice that there's a very dramatic spike in deaths immediately after release from prison. And it's this finding of this acute spike in deaths just after release from prison that's really led to a focusing of attention, such to the extent that we have efforts for prevention, on that acute period immediately after release from prison. And if you look at the causes of death in the first month and the first year after release from prison, and it's in stark contrast to what we see in prison. You recall that the majority of deaths in prison are from natural causes. the majority of deaths after release from prison, even out to a year post-release, are from unnatural causes, which is really a reasonable proxy for preventable causes. These deaths shouldn't be happening, and indeed drug-related causes and suicide account for the majority of those preventable deaths. So this is such a well-replicated phenomenon, that phenomenon being the spike in deaths immediately post-release, that Sheila Bird, Elizabeth Merrill and others did a systematic review and meta-analysis a few years ago. And the takeaway point is this, that the risk internationally, to the extent that data were available, the risk of drug-related death is 3 to 8 times higher in the first 2 weeks post-release than in the subsequent 10 weeks. So there is a really significant and acute spike in deaths just after release from drug-related causes. And as I've said, that's really been the one area where there's been some attention around prevention because it's so well documented. And in fact, the WHO has recently released the second edition of a very well put together report on evidence-based ways of reducing acute drug-related death in people who've just been released from the criminal justice system. So we have some evidence and then we have a response. But there is a problem, and one of the problems is that that's not true for everybody. Here's a paper that Simon Forsyth and I published a couple of years ago on addiction, where we looked at differences in substance-related death after release from prison for Indigenous and non-Indigenous people. So you'll recall that spike in deaths just after release from the other slide. What this is showing you is the rate of alcohol-related death and illicit drug-related death by week after release from prison, separately for Indigenous and non-Indigenous people. So I'm sorry if you're not a visual person. Basically, the take-home point is this. This line here is the rate of drug-related death for non-Indigenous people, and it pretty much replicates what we think is true everywhere. This is what Elizabeth Merrill's meta-analysis found. This is what the WHO's report on preventing drug-related death finds. It turns out that's not true at all for Indigenous people. At least in Queensland during the years of our study, there was no spike in drug-related death immediately after release from prison. Why does that matter? It matters because our very limited prevention resources are currently being targeted exclusively at preventing drug-related deaths immediately after release from prison. And to the extent that we do that, we again selectively disadvantage Indigenous people who, although they're not dying from drug-related causes in the first week, over the longer term are just as likely to die of substance-related causes as non-Indigenous people. So we can't just take the global evidence, chuck it into our local context and get on with it. We really need local evidence to inform what we do. And I mentioned before that it's not just drug-related deaths that are really prominent in people just released from prison. One of the other big ones is suicide, and we always have concerns about whether suicide's been accurately coded, and it may well be underestimated. But based on the ICD-10 codes that we get from the National Death Index, this is a paper by Matt Spittle from University of Melbourne, comparing the rate of drug-related death and the rate of suicide death after release from prison by time. Okay, and just to illustrate this point to you again, this bar here is the rate of drug-related death in the first 2 weeks after release from prison. That's that spike that we know about. This is the rate of suicide death in the first 2 weeks after release from prison. The fact that it's not elevated in those first 2 weeks is one of the reasons why I think people haven't focused on it. Well, it's not really a prison-related thing, it's just people in the community. But when you look in the longer term, the rates of drug-related death and suicide death after release from prison are about the same. In other words, even though there's no spike in suicide deaths in the first week or two after people get out of prison, over the longer term, people are just as likely to die by suicide as they are from drug-related causes, and so therefore it should be as important a focus for us in terms of prevention, but it's not. I haven't got much news in this presentation, good news in this presentation, I'm sorry to say. Even over the longer term, things don't get much better. This is a slide looking at the long-term survival up to 15 years after release from prison. So these are survival curves. If everybody was still alive at the end of the 15 years, you'd have a line across the top. This red line is the rate of mortality we would expect in Queensland over those 15 years among people with the same age and sex distribution as prisoners. This black line with the green confidence intervals is the rate of mortality that we actually see among people released from prison in Queensland. So out to 15 years after release from prison, the rate of mortality among ex-prisoners is more than 3 times higher, the rate of mortality in the age and sex-matched general population. So the news doesn't get better after those first few weeks. So I hope I've really rammed that point home. Acute drug-related deaths matter, but there's a much bigger picture out there as well. The vast majority of preventable deaths happen after those first couple of weeks. We must focus on both. And another reason why we can't just rely on the published research to inform our local responses is that things change over time. That's why surveillance systems exist, because what happened 10 years ago may not be true now. This is just one poignant illustration of that. Who's aware that we had a heroin shortage in Australia about 15 years ago now? Right, we had a very dramatic drop, and Turning Point did some really important work in documenting that and some of the consequences. One of the consequences was a dramatic reduction in overdose deaths, but no one thought to check whether the same was true in people recently released from prison. So this shows that it is. This is looking at the age-adjusted crude mortality rate for people released from prison between 1994 and 2006. The green line is the opioid-related deaths, the heroin overdoses. The reddy pinky line is the all-cause mortality rate. So this is the thing I'm trying to point you to here, that this precipitous drop in opioid-related deaths around the time of the heroin shortage. So again, while heroin overdoses just after release from prison are important, as you can see there, they became very considerably less important in 2001. So we need to think about other causes of death. We need to think about other responses if we want to meaningfully impact on population mortality in this group. So that's why we think that although the research that we have to date is useful, one of the things, not the only thing, but one thing we need is some routine monitoring here, some routine surveillance around mortality after release from prison. So I presented to you that slide before, comparing deaths in prison to deaths after release from prison, our estimates of deaths within 28 days and a year of release from prison. We had a lot of media around that paper, and to my great surprise, someone from Centrelink called me and said, well, we can do routine monitoring of deaths after release from prison. And that was the beginning of 2011. We've just submitted the paper, which goes to show how long it takes these things to actually evolve. But it turns out they could. And they can and they did. Whether they will continue to do so remains to be seen. But I just want to explain to you now what we did. So for those of you who aren't technically minded, I'm sorry, this is a little bit kind of techie, but it took me a while to wrap my head around it, and I'll try to explain it in as non-techie language as I can. Basically, in order to monitor deaths after release from prison, we need to know 2 things. How many people there are potentially at risk of dying, how many people are getting out of prison, and how many of those people die. That's pretty simple, you'd think. Turns out we can get both of those things from Centrelink data. And so here, let me explain why that's the case. Since November 1999, Centrelink has had a specific crisis payment for people being released from prison. Anybody working in a clinical setting might be aware of this. And so because of that, if anyone who's eligible for payments after release, who's been in prison for 14 or more days, and who can demonstrate hardship, whether they're on a sentence or on remand, is eligible for this payment. And so nearly everybody getting out of prison is eligible for this payment, really. So therefore, it's a pretty good proxy for the population of people being released from prison. Who knew? It also turns out that the Commonwealth Government is really good at not spending money unnecessarily, and so they go to considerable lengths to avoid paying people their Centrelink benefits when they shouldn't be getting those benefits, which works really well for us in this particular instance, because 2 of the reasons that they terminate benefits, one is people returning to custody, if they find out that people have returned to custody, and the other is if they find that people have died. And as I mentioned, they do quite a lot of work to try to find out if people who are receiving benefits are deceased. They do a monthly linkage with the Registrar General's offices across the country, and they get notifications directly from family, from police, from hospitals and so on, and they use all of that information to stop paying benefits to people due to death. So therefore, Centrelink benefits can be a proxy for the number of people who've died while on those benefits. So the question that we had is it good enough? Are we good enough at picking up the people being released? And are we good enough at picking up the deaths among those people being released that we can use these data for routine surveillance purposes? So it's basically a byproduct of existing administrative data. which is a great way to set up a surveillance system. It doesn't cost a lot of money. So here are the aims of what we wanted to do. 3 things. What proportion of releases from prison and what proportion of deaths among those people is captured in Centrelink data? In other words, is this a passably valid mechanism for monitoring deaths? We expected that there might be some sampling bias, so we wanted to quantify any sampling bias. In other words, what subset of people who is released from prison, what subset of people who died is picked up in Centrelink data? So are we picking up different sorts of people, for example? And then, assuming that the data are good enough to make it worth doing, we wanted to estimate the number of deaths among ex-prisoners in Australia within a month and a year of release from prison, from 2000 up to 2013, and hopefully on an ongoing basis into the future. So that was our plan. So what did we do? We got Centrelink records, and we got Centrelink to, or they did it themselves actually, pull out data on every prison crisis release payment from 2000 to 2013, and they're all date stamped. So that's the begin observation date. That's the date in which people are at risk of dying. That's the date they got out of prison. So in other words, we have the date of release for every person released from prison on a Centrelink payment from 2000 to 2013. And then we got Centrelink to match that up with records of termination of benefits for those people for the same years, actually at the end of 2014, and find out if those people had their benefits terminated because they went back to prison, so they couldn't die in the community if they're in prison, or if they died and had their benefits terminated for that reason. So that's the mechanism. How do we find out if it's useful or not? How do we find out if it's good enough? What we did is treat the study, I presented some slides from the Queensland study I showed you, and treated that, although it's not perfect, as a gold standard. That study involved a linkage of correctional records in Queensland provided by corrections with the National Death Index. Now we know that that's pretty good. We know it's extremely good. We know that it's got high sensitivity and high specificity. We gave AIHW up to 13 aliases for the people in our cohort to improve the match with the National Death Index. So although it's not a perfect gold standard, it is a pretty good gold standard. So in other words, we're pretty confident that we know exactly who died after release from prison in Queensland over those years, and we want to compare that with what we would get if we used Centrelink records only. And the question is, are the Centrelink records on their own good enough? So the years that overlapped between our Queensland study and the Centrelink data were 2000 to 2007, so 8 years worth of records. How are we going so far? Am I? Okay, great. So, there's a formula, but it's a really simple one. For each calendar year, so for the year 2000, 2001, 2002 and so on, we identified the number of people released from prison at least once. We stopped following them a year after their release because we're interested in deaths in that first year after release from prison. We stopped following them if they went back to prison, although we started following them again if they got back out of prison. And we stopped following them obviously if they were deceased, according to Centrelink records. So then we can sum what are called the person years of observation. So in total, how many years of following people in the community do we have in these people? And then we counted the number of deaths among those people within 28 days of a release and within 365 days of a release. So that's how we computed this. So that's what it looks like. Your crude mortality rate per 1,000 person years is just the number of deaths divided by the person years at risk multiplied by 1,000. Like I'm not a statistician, and after a bit of a sit down I was able to get my head around this, so it's not too bad. So how do we go? I've got 3 slides with squiggly lines on them that I'm going to explain to you. This is the bit where we compare our mortality estimates using Centrelink data in red with what we consider to be a gold standard with our Queensland mortality data. Now we've done this for deaths within 365 days of release. We also did it for 28 days, and I've got a slide I can show you, but the numbers move all over the place because they're much smaller. So this illustrates the point better. So this is years, 2000 to 2007. In red, what we're looking at is the mortality rate per 1,000 person years, according to Centrelink data, and in the same people, the mortality rate per 1,000 person years using our gold standard data linkage study. So you can see that basically at the beginning of that period, it was not too good. The Centrelink data were dramatically underestimating mortality. By the end of it, it was lining up pretty well. And in fact, there's a statistically significant increase in mortality rate in the Centrelink data over that period, whereas there isn't in our data linkage study. So there's really good convergence in mortality rates by the end of 2007. So what that suggests is that we're coming up with pretty similar answers using the Centrelink data and using a gold standard data linkage study. But because we're collapsing across all of those years, it turns out we're under-ascertaining or underestimating the crude mortality rate using Centrelink data quite a bit. So within 28 days, our average mortality rate that we estimate using Centrelink data is 52% lower than what we get from our gold standard data linkage study. Within 365 days, it's 24% lower than we get using our gold standard data linkage study. So in other words, it's not perfect. We're not picking up all of the deaths. We're picking up a good number of those deaths, but we're also missing quite a few. And we'll come back to what that means for monitoring in a moment. So the second thing we wanted to know is, okay, so we're missing quite a few deaths here. And are they different? Are the people who we're picking up different to the people that we're missing? You know, are we doing a better job of picking up deaths among Indigenous people, among men, among young people? So this is a table that compares the characteristics of the people in our gold standard data linkage study and the characteristics of the people in our Centrelink data. And let me just talk you through it. It turns out that the Centrelink data are pretty good at picking up the population of people being released from prison. Our study had 49,000 releases from prison during that period. The Centrelink data picked up a bit over 45,000 of those releases, so missed about 7.9% of them. So in other words, Centrelink data pick up most people getting out of prison. The reason being that most people get a crisis payment on release from prison. So we're good at that. We'll come back to these rows in a moment. As you can see here though, Centrelink data did a pretty bad job of picking up deaths within 28 days of release. In fact, we missed 45% of those deaths. So we're not too good at picking up deaths within 28 days. And the reason, as you'll recall, is that one of the ways that Centrelink picks up these deaths is with a monthly linkage to the Registrar General's office. That's not happening quickly enough to pick up deaths within 28 days for the purposes of monitoring. So we're missing a big chunk of deaths. Up to a year after release, it gets a bit better, but we're still missing a third of deaths. So what you're seeing here is that we're picking up nearly all of the population at risk, but we're missing a meaningful chunk of the deaths among those people at risk. When you look at the characteristics of the people that we're looking at, the characteristics of the people who we're picking up, the characteristics of the people who die within 28 days, and the characteristics of the people who die within 365 days, they're almost identical. So what that means is, although Centrelink data miss a significant chunk of deaths, there doesn't appear to be any bias that we can pick up in the characteristics of the people. So in other words, we're probably doing a fair job of picking up the types of people who are dying. It's not systematic bias, it's just under ascertainment. That's particularly important because, as you know, we've got a monitoring system for deaths in custody that's been driven by concerns around deaths among Indigenous Australians in custody. So we were really concerned to make sure that we weren't over or underestimating deaths among Indigenous people after release from custody. And it turns out we're not, according to the data that we have. So what does that mean for routine monitoring? Well, I'll come back to it, but I think what it says to me is that it's imperfect, but I'll argue in a moment that it's nevertheless adequate. Assuming for a moment that it is adequate, here's what we get when we apply this system nationally to look at deaths within, in blue, 28 days of release, and in red, within 365 days of release from prison for each calendar year 2000 to 2013. So what do you see here? We've got confidence intervals around the deaths within a year. We don't have confidence intervals around the deaths within 28 days because they're huge. You can see there's a lot of noise in those data, a lot less noise in the data for deaths within a year of release. What we're looking at here is the rate of death within a year of release from prison. And you can see there the linear trend is there's a significant increase in the rate of death among people released from prison over this time, which, if it's true, is obviously of concern. We'd be very interested to know why it is that we might be seeing a significant increase in rate of mortality after release from prison over the last 13 years. I didn't put it on here, but the rate of death in custody, according to the Australian Institute of Criminology, is about there, for deaths in custody within a year. And in fact, that rate that they publish is dramatically overestimated for reasons I can go into in the question time if time permits. And I mentioned before that our data suggests that we're doing as well at picking up deaths among Indigenous and non-Indigenous people, which is important because we want to have a focus on deaths among Indigenous Australians after release from custody as a focus of what we're doing here. So it turns out that the rate of death, according to these data, among Indigenous and non-Indigenous people after release from custody is about the same. And as you can see there's been a trend upwards in the rate of death in both groups over that period of time. So, great, I've left plenty of time for discussion. Here's my one-slide summary of what we think all of this means at this stage. When the reviewers get back with our paper, that we might think something dramatically different, but this is what we currently think. This system that we've developed and attempted to validate, it appears substantially under ascertained deaths. It picks up most of the people who get out of prison, but it misses a significant number of the deaths among those people. There could be multiple reasons for that. It could be failures in data collection. It could be delayed reporting. It could be that people are off benefits. Goodness knows, they may have actually become employed and then died. And of course, this system relies on people being on benefits at the time of death so that we can use death as a reason for termination of benefits. So we would never expect it to pick up all deaths. Okay? Does that make sense? No evident bias. So it's not that we're picking up only deaths among non-Indigenous people, only deaths among Indigenous people, only deaths among young women or some other group, which is encouraging. So it's not perfect, but I think the really important point is that for the first time nationally, and as far as we can tell the first time globally, what we have is a count of deaths among people after release from prison. It's an undercount, but it's not an estimate. In other words, the number that we've documented here is at least the number that are actually dying is at least that number, and probably considerably more than that number. And that's important because the mortality rate that we've generated using this system is already orders of magnitude higher than the rate of death in custody. So while it's undercounting deaths, I think it's still an extremely compelling story. So deaths after release from prison are considerably greater than deaths in prison. That's not to say that deaths in prison shouldn't be a focus, they absolutely should, but I think that these data provide some very compelling evidence that we need a commensurate focus on preventing deaths among people recently released from prison. So we argue that it's sufficient for routine surveillance. It's not perfect, but it is sufficient, and as you saw from the first squiggly line graph I presented, there's good evidence of convergence in our gold standard data and in the data from Centrelink, so it's probably the case that their data are getting better over time. So unfortunately there's no commitment to future reporting. We had to dig out some research funds to pay for this, and the AHW chipped in some as well. Nobody's put up a hand to pay for it in the future. Turning Point, of course, being a leader in the use of routinely collected data for surveillance purposes, may be an appropriate body for that sort of thing. One of the things that is a concern though, and again this is something we were very careful with the paper that we've submitted, is that as you saw, the Centrelink data suggest an increasing trend in mortality rate over time among both non-Indigenous and Indigenous people. We also saw though that there was evidence of better data over the years as well. So are we seeing an increase in mortality rate? Or are we just seeing that this routinely collected data are getting better and better over time? And we need to be really careful there that we don't get into a panic over what appears to be an increase in the rate of death when it's actually just better data. And this is a problem in all surveillance systems, passive surveillance systems, but it's a really, really important one, particularly for such a sensitive topic. Another huge, huge problem that's often overlooked is that this excludes young people in youth detention. Now, of course, we're doing a lot better at keeping young people out of detention than we are at keeping adults out of detention, but we're still not doing very well. And as you know, Indigenous people are overrepresented in youth justice by a factor of 15 to 1. So again, this is something that very disproportionately affects Indigenous Australians. So the fact that this system excludes young people who've had exposure to the youth justice system is another big concern, and that's something we're still keen to talk to Centrelink about and see if there's a way to address that. The other issue though is that it just gives us a count, how many people have died. We don't really get any information from the system on why they died. We don't have any cause of death. We certainly don't have any information about the context surrounding the death. And that's obviously important when we go from hand-wringing epidemiology to prevention. We want to actually figure out what we can do to prevent these deaths. We need to know why they happened in the first place, not just that they happened. So I guess what we'd say is that this system, like all passive surveillance systems, is really something to complement research projects. It's not a replacement for targeted policy-focused research. It really is hopefully something that will help make the case for that sort of research, is our argument. And just before we go to questions, I just wanted to share with you two studies where we've shamelessly done exactly that and used this sort of evidence to advocate for more research. We looked quite closely into this issue about youth justice, and we found that it turns out that there's only ever been one study globally that used data linkage to look at deaths after detention, youth justice detention. That was by Carolyn Coffey in Victoria about 15 years ago. And it looked at about 2,500 young people after their first episode of detention. And so what she documented is a rate of mortality a lot higher than you would see in the community, and pretty much consistent with the adult system. The majority of those deaths were due to preventable causes, drug overdose, suicide, injury, and so on. That's the only study globally, and nothing since 2001. That knocks my socks off. So what we did is decided to improve upon that. So we recently got funding from NHMRC to do a study where we're looking at youth justice records in Queensland. In fact, we've looked at every young person who had contact with the youth justice system between 1993 and 2014. It's about 50,000 young people, we think. And we've linked that with adult correctional records, with the National Death Index, and then we'll be pulling in data from the National Coroners Information System as well. So we're going to have this very rich, really for the first time globally, be able to have a proper look at patterns of mortality in young people moving through the youth justice system. To date, it's been largely forgotten. There's the numbers for those of you who are interested, are about 50,000 young people. Of those, about 8,000 we think will have been in detention in Queensland, about 13,000 on a community-based order, and 29,000 charged but never found guilty of an offence. And we're going to be following those young people forward to look at deaths over time. The other thing that we're doing is that even though I've hopefully persuaded you that the rate of death after release from prison is a lot higher than you would see in the general community, it's still a relatively rare event, particularly among a relatively young population. So you really need huge numbers to start making really meaningful inferences about what's going on. Individual studies, even our study with 42,000 people, don't have the numbers to really drill down and ask questions like, does the rate of overdose death among young women change over time after release from prison? Are the number of injury deaths in older Aboriginal men greater from the first 5 years to the next 5 years? Those sorts of more focused policy relevant questions. You really need huge numbers to do that. So Rowan Borshman from MCRI and I have recently put in an NHMRC grant to do this, where we've basically pulled together the data from all of the cohorts around the world that have looked at mortality after incarceration as an adult. So this is just to share with you some of the things that we're doing moving into the future. So we're very excited about this because we've actually just added one more cohort. We've now got 1.2 million people around the world who've been incarcerated, who've been followed through data linkage to look at mortality. We think there's now nearly 40,000 deaths in that cohort. It's kind of a bit macabre to get excited about these sorts of numbers, but what it does do is it really allows us to explore complementing routine surveillance to start asking much more policy relevant questions, to start really understanding what are the patterns of mortality in particular subgroups, why do they die, when do they die, what are the causes of death, and what can we do to reduce the risk of that happening. Time for questions. Thank you very much.